Okay, the name of this video is Spine Surgeon Says I'm Right. So this is a very popular video on YouTube. This guy's YouTube channel is called Gooby and Dooby. It's kind of a strange name, but he is an MIT, Massachusetts Institute of Technology educated neurosurgeon. So he did a full residency in brain surgery, which includes surgery of the spine. Then he went and did an additional fellowship in spine surgery. And he decided to quit being a spine surgeon, and he gives his explanation of why. This video is so popular, it's gotten over 8 million views. Why would somebody give up a very profitable job? You know, a lot of times a neurosurgeon will go into spine surgery because in some ways it's easier than being a brain surgeon. What I mean by that is if you're a brain surgeon, you're going to get paid, you know, every Friday and Saturday night practically for some type of emergency. You know, motor vehicle accident, intracranial hemorrhage, or old person fell, subdural hematoma. So there's an old joke about neurosurgeons. It's basically, you know, how do you hide $100? How do you hide $100 from an internal medicine doctor? You put it under a surgical dressing because they're really squeamish. They don't want to touch anything. Okay? How do you hide $100 from a cardiologist? And the joke is you can't do it because they're so money-minded and greedy, you can't hide $100 from them. So then the last part of the joke is how do you hide $100? Well, first of all, it's how do you hide $100 from orthopedic surgeon? So the joke about orthopedic surgeons is that they're stupid jocks, and they never look in the chart. So you put it in the chart. Okay, then the next one is how do you hide $100 from a neurosurgeon? And the joke is you tape it to his kid's forehead, and the reason is they spend so much time working in the hospital and on call, they never go home. He'll never see his kid. So neurosurgeons are overworked. They tend to be workaholics. They tend to have a sky-high ego and think that neurosurgery is the greatest thing in the world, and they kind of have to be that way because why else would somebody accept such a miserable lifestyle? They get sued a lot. They get stuck with these hopeless train wreck cases where there's nothing you could do, and they sort of feel obligated to operate. So I know lots of neurosurgeons, and I like them. I try to be as nice as I can to them, but I do feel sorry for them. So even though they sound like this glamorous, wonderful thing, in real life they're kind of overworked, exhausted workaholics. Okay, so anyways, what's the point of this talk? This guy did a spine surgery fellowship, so they pay really good money for doing spine surgery, you know, doing posterior pedicle screw fusions, all this hardware, it bills for really high amounts. Why would somebody give up that really rich life? He's a married guy with no kids, and he said that he noticed something, that if the patients would eat a plant-based diet, low in sodium, and they would stay warm and exercise, no alcohol, no tobacco, get their sleep, manage their stress, he said they would usually get better and not need any surgery. He also noticed that he could operate and he could do a perfect surgery, everything great, and the patients quite often didn't get better. And so what was that all about? I think part of what that's all about is a surgeon can control their operation, but they can't control the scar tissue. Some people make more hypertrophic scar tissue, and that can pull on a nerve and create recurrent symptoms, even though technically the operation was very well done. He sort of felt like he wasn't doing that much useful work, and he didn't feel personally fulfilled. So he quit working as a spine surgeon, and according to the video, he says he didn't even know what he's going to do next, but he just didn't want to do that. And why do I say he says I'm right? Well, I made the observation that, you know, there were some papers written back like in the 1980s or so showing an association between atherosclerosis, let's say of the abdominal aorta, and degeneration of the disc, degenerative disc disease. And that's a big deal because degenerative disc disease is super common. I did, though, take this observation and made it go much further. What I had noticed is you'll often get bridging osteophytes of the vertebral bodies. That's called DISH, diffuse idiopathic skeletal hyperostosis. And you'll also often get calcification of the posterior disc, even hypertrophic bone growth along the posterior longitudinal ligament here. And that's really OPLL, ossification of the posterior longitudinal ligament. There's ossification of the ligamentum flavum back in here, OLF, and there's Bostrup's disease, you know, ossification and fusion of the posterior spinous processes. But I sort of figured out that it goes all the way from the sacrum, the DISH, the DDD, degenerative disc disease, and there's also calcification of the disc with interbody fusions. And this process just marches itself all the way up to the skull. And it's because you get accelerated segment degeneration. Just like if you fuse a level, you'll get accelerated degeneration of the disc both above and below that. And so when the spine fuses itself, and the reason it fuses is because there's abnormal motion. When the disc is ischemic, not having enough glucose being delivered to it because of poor blood supply, the disc will fail. The outer parts, the annulus fibrosus, like a steel-belted radial tire, it fails. Then the disc centrally, the nucleus pulposus, like the center of a jelly donut, it dries out. You get abnormal motion. That's called segmental instability. The spine has a lot of proprioceptors, senses the abnormal motion, and fuses the segment, laying down calcification, which progresses to ossification. And that then goes all the way up and down the spine. And whether it happens in front with osteophytes, like in dish, or in back with bony bridging on the posterior aspect of the VB along the disc, OPLL, ossification posterior longitudinal, it's all the same thing, a form of degeneration. And the relevance of that statement is back in the 1990s, all the textbooks said it's a rare thing, let's say OPLL, that occurs in Asians occasionally. I see it all day long, every day, and they say it's only in the cervical spine. I see it every day in the lumbar spine. Okay, so anyways, what's the point of all this? What I said in this book, I wrote this book, Ischemic Spine is the Most Common Cause of Back Pain. What I said was, if the patients would just do this stuff here. Eat a low-fat, low-sodium diet. The same diet like the Esselstyn diet that optimizes blood flow in the heart. It's the same problem in the spine. Main problem is lack of blood flow. There's two additional chemical problems. The glyphosate, glycine phosphate, it appears that it's interposing itself into the triple helix of collagen. Collagen is a triple helix protein. Every third amino acid is glycine, and glycine phosphate gets in there. The bulky phosphate attached to the glycine distorts the shape of the ligaments, which are made primarily out of collagen, and that will cause weakening of the spine. Fluoride can substitute itself for a hydrogen, and that can also disrupt the structure of collagen. There's a disease of the spine called fluorosis, which just so happens to look like DISH, diffuse idiopathic skeletal hyperostosis, which I see all day long every day. So the point I'm saying is, this guy's telling the truth. He recognized that basically I'm right about everything I said and written about the spine, and that tremendous, but no one wants, I couldn't get this published in the journals. I'd applied for grants. They wouldn't give me grant money. I got pissed off. I go, screw these assholes. I'm just going to write a book. I actually wrote 2 books about the spine. So anyways, that's the relevance. That's what it's all about. Now, don't get me wrong. Some patients really do need surgery. Some people have a large disc herniation. They'll have a developmentally narrow central spinal canal, so it really can't have much room to support a big disc herniation, a disc extrusion, for example, and especially up in the cervical spine, that big disc extrusion, that's a name for big disc herniation, pushing on the spinal cord can compress the spinal cord, make the patient quadriplegia, and can cause severe neurologic deficits. Those people really need spine surgery. And so there's some other categories where they really need it, but a lot of spine surgery doesn't really need to be done. The patient's fixated in their mind, they want surgery, the surgeon gets paid a lot to do it, they figure, why don't we give it a try? So anyways, I think, if you find the video, he's a very nice guy, a real intelligent, clear-spoken guy, so you might find it interesting, but I found it rather amusing that, this guy's got all the training in the world you could want your spine surgeon to have, and he basically comes out and says, this is right, and he's trying to figure out what he's going to do next in his life. So anyways, interesting on what causes back pain.